Gigi. So our topic today is about agent anti-infective skin. What is agent anti-infective skin? Agent anti-infective skin is a topical anti-infective agent acts by attacking or inhibiting the spread of the infection agent. They include antibiotics, antibacterial, antifungal, and antiviral agents. Topical anti-infective agents are applied to the skin, on the nail, onto mucous membranes, or vaginally to treat the infection. Okay, so the next is example of drug. So this is our example of drug. The first is bacitracin. Second is silversulfadiazine. Third is ivermectin. And the lastly is chloroquine. So for action of ivermectin, it will reduce inflammatory lesions of rosacea lesions such as redness, swelling and pimples. Second, silversulfadiazine. It will disrupt bacteria by damaging the cell membrane and the cell wall. This helps to reduce the risk of the bacteria from spreading to surrounding skin or to the blood. This will help to decrease the risk of the bacteria from spreading to surrounding skin or to the blood, where it can cause a serious blood infection. Third, bacitracin. It will prevent infection in minor skin injuries such as cuts, scrapes and burns from becoming infection. For the last drug is chloroquine. It works by preventing the growth of fungus or bacteria on the skin. It will treat skin infections such as eczema, athlete foot, and joint itch.
Contraindication of anti-infective skin. First is ivermectin. Ivermectin is used to strachidialysis and to treat onchocerciasis. Silversulfadiazine is for wound infection and prophylaxis of wound infection. And next is bacitracin. Bacitracin is for acute and chronic localized skin infections. Next, as an ointment with toxins and polysis B of over-the-counter one. And for chloroquine, it's used to treat infection of the skin and provide relief from direction, itching and discomfort of many skin infections.
So for the dosage, the first drug is ivermectin. So this dosage is apply a thin layer to the entire face on daily. That is cream. Each gram of cream contains 10 mg of ivermectin. Second drug is silversulfadiazine. So these drugs apply over the affected area to be a depth 3 to 5 mm and 1 to 2 times daily. So the second drug is silversulfadiazine. This drug is applied over the affected area to be a depth of 3 to 5 mm and 1 to 2 times daily. Second, burn site should always be covered with cream. Reapply to areas removed by patient activity. The third drug is bacitracin. So this is drug applied thinly to affected area 1 to 3 times daily. The last drug is chloroquine. This is drug applied 3% cream or ointment 2 to 4 times daily onto affected areas, cleanse and dry thoroughly.
Okay, for the side effect, first we have ivermectin. Ivermectin can make your skin burning, itching, redness or stinging of the skin. Okay, also make your skin dry or itchy eyes. Next, ivermectin also make your skin dandruff. Also discharge of excessive tearing and also dry skin. Next, for the side effect of silver sulfadazine, first, silver sulfadazine can make your back, leg and stomach pain. Also, blistering, peeling and loosening of the skin. Next, it also can make your skin blue-green to black skin discoloration. Also, fever with or without chills. Also, intense itching of burn wound. Okay, next for bacitracin. Bacitracin can make you nausea, vomiting, skin rashes, itching and also difficult breathing or swallowing. Okay, for the lastly, side effect for quinol. Quinol can make your skin thinning. Also, severe burning or skin irritation. Also, and the last one, blurred vision or seeing halos around lights. Thank you.
Contraindication for bacitracin. Contraindicated in person with hypersensitivity to bacitracin and neomycin. For ivermectin, contraindicated in person with hypersensitivity. Silver sulfadazine, contraindicated in person who hypersensitivity, premature infant and pregnancy women. Glyconol, contraindicated in person who hypersensitivity and child below 2 years.
So for the question, for the first route is bacitracin, and then we need to avoid to give this medication from someone who have intensive burn, and then the patient with deep puncture wound, bites or other extensive condition where you can absorb if possible, and then not to be used near the eyes, nose, mouth and mucous membrane, and then we need also to give this medication with caution to someone who is pregnant and give lactation. And then the last one is we need to avoid these medications from children that lower than 2 years. For the second drug is silver sulfadazine. We need to give with caution to someone who have G6PD deficiency, because it is a hereditary metabolic disorder that can affect the red blood cell, because it can cause the blood problem to the patient. The next is kidney disease, and then we need to give this caution to someone. Next is we need to use this medication with caution to someone who have liver disease, because it can can increase the effects of this. Next is liver disease. We need to use with caution, because the effect may be increased because of the slower removal of this medication from the body. And then the last one is the porphyria. We need to use with caution of this drug, by using this medication can result of several attacks of porphyria. For the third drug is ivermectin. So we need to be cautious to give this medication with caution. Who have an allergy to this drug, who pregnancy and give breastfeeding, and then it is for oral, ophthalmics and also intravenous. And then for the last drug is triquinol. We need to avoid to give this drug to someone who is pregnant. For the last drug is quinol. we need to give this medication with caution to someone who is pregnant, and then giving breastfeeding, and then we need to avoid those children because children may be more sensitive to the effect of too much corticosteroid medication. And then the last one is someone who is allergic to this drug.
Okay, and the last one is drug interaction. First, for ivermectin. Drugs that interact with ivermectin is abamectin. The serum of concentration of ivermectin can be increased when it is combined with abamectin. Next is abemaciclib. Abemaciclib may decrease the excretion rate of ivermectin, which could result in a higher serum level. Okay, the next drug is ciprofloxacin. Ciprofloxacin can interact with estrone. This concentrated efficacy of estrone can be decreased when used in combination of ciprofloxacin. Next is magnesium. The serum concentration of magnesium can be decreased when it is combined with ciprofloxacin. Okay, the next drug is bezitracin. Bezitracin can interact with aclidinium. Bezitracin may decrease the excretion rate of aclidinium, which could result in a higher serum level. And then acrylvestine. Bezitracin may decrease the excretion rate of acrylvestine, which could result in a higher serum level. For the nucleoquinol drugs, it has no drug interaction. Thank you.